Hi everyone, Dr. Dave here with Synergy Wellness. So now we have an upper cervical adjustment for somebody with Bell's palsy or facial paralysis. So for those of you watching, you probably put in the keyword Bell's palsy, facial paralysis, facial neuralgia, whatever that term was. And for many of you, you've tried all sorts of treatments, and it's a very frustrating condition. They say it passes. Were you told that it passes and goes away?
Yeah, I was told that.
Yeah, so, and for many it doesn't. So he's had it for a year and a half now?
Yeah.
A year and a half now, done a lot of different treatments. They all kind of help a little bit, but I've been doing this for 25 years and I've only been using laser for 15. I can tell you the laser is powerful. The chiropractic adjustment is too. With acupuncture, they could be really helpful, but the laser is extremely powerful. And that's gonna get right to the cause, right to the nerve. It's going to do what I can't do, what humans can't do, what medication can't do. Okay, it harnesses the body's natural ability to reduce the inflammation and calm the nerve or stimulate the nerve, depending on the frequencies you use. So that coupled with this upper cervical work, and he has some, you tender right there?
Yeah.
Some suboccipital pain. So you can see here up on the screen, we'll put a picture of your suboccipital tendons where they attach to your skull. And I've definitely done videos on how to stretch that. But what you do is you lay down on your back on a yoga mat, not on your bed or on a carpeted floor. And you put the towel, just a round lacrosse ball, not a tennis ball, a lacrosse ball. And then if you have hair, like everyone else but me, like this guy, you're gonna put a towel, a hand towel over the ball and then lay on it with your, right over the suboccipital tendon where it meets the skull. And you'll feel tender spots up there. Now don't roll the ball below that into the neck area because that could cause some more problems for you, okay? So just do it up at the top, the ridge, and it goes from behind the ear, you'll feel it, the bottom of your skull, all the way around to the other ear, okay? So just at the bottom and behind the ear. And that's how you find it, and you can travel all the way across. Some of you may have really tender spots on one side, the right or the left. Some may have it on both sides. So when you lay on your back, you're gonna tuck your chin in. Go ahead and tuck your chin in. And you're going to flatten your neck in a way on that ball and just hold it there. And it's gonna be tender. And like hold it there for about 30 seconds to 60 seconds and it'll subside. That tenderness will go away. Don't do more than that in the beginning because it's going to be sore, I promise you. And you may have to wait a day or two to do it again. And then you'll move the ball a little bit over, not even a millimeter, 2-3 millimeters maybe over, wherever you find that tender spot along the bottom of your skull there, that ridge. It's called the occiput. And then you just hold it there for 30 to 60 seconds. You can wiggle your head like I'm doing to his head right now, just gently back and forth, just very, very gently, not like this, just a very gentle motion like this on that spot. Again, 30 to 60 seconds, it should subside if it doesn't completely move on to the next spot. Otherwise, you're going to be too sore. And go from the back of the ear there all the way across to the other ear. And that will help. And if you have headaches, that's gonna help immensely with your headaches. With 90% of you out there that have headaches or migraine headaches, that technique using the lacrosse ball will help reduce your headaches by at least 50 to 75%. You're wondering, well, what's the other 50 to 25%? And that's typically a chiropractic adjustment to realign the spine. Okay, we find it in everybody. Just the birthing process is traumatic to the neck. So he's doing really well up here. I don't have to adjust him up here, but except for his occiput, I'm going to adjust him. And I just adjusted his lower cervical spine. So go ahead and lay on your stomach. So I adjusted the occiput a little differently. I use a technique called Thompson technique. And what we do is we want to find the occipital condyle that's lower on one side. So he has an anterior tilt to the occipital condyle. So it's not that one is lower than the other. So we're doing a little bit of a different adjustment and tuck that chin in really hard there. Good. And one more. Okay. And turn over on your back. So we don't do all adjustments for Bell's palsy and facial paralysis, facial nerve issues like this. Every case is different. Every adjustment is different. Cross your arms here. Take a deep breath in, tuck your chin. Come on up, half a sit up, good. And blow out. All right. And that's it, folks. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.